grab it. There we go. You can open it, but I've actually even grabbed it when closed. Do you want to make sure that you drip the water off? Please don't grab it with your fingers. You actually will change the sensation in your fingers over time. So there are a lot of therapists that can practically reach the whole hand in there, and that's probably a good idea. Just saying. Why am I doing a circle? Because I want you to feel it. So I'm going to pass that around so you can feel it. And open it up and actually touch the hot pack. Carefully. Don't burn yourself.
What's in the middle of the hot tub?
It's a silicone gel stuff. It used to be from the Chattanooga River, right there.
Really?
Yeah. Yeah, I think it's Chattanooga was one of the originators. But now, I don't know where it's from. But it's just, if you see it leak open, it actually kind of looks like this weird gray, almost looks, I don't know how to say it, weird gray-like material. So in the cover, okay, and yeah, it's towels. So how many layers?
6 to 8.
Right, and this is
2.
2. So if I put it on like this, how many layers? 2. Well, I'm just about the towel. 2. Now, these are new towels. You can tell they have not been washed or been pressed or something. But remember, it's capturing the air that helps. So this probably wouldn't be really a full double towel layer because it's not going to be able to trap the air because it's not fluffy. So you just need to be aware. We have and sometimes what I'll even do is I'll take one of the layers, or I'll take something like this and I'll just put it over the top. So I'm trapping the air from above also. So it's not losing heat this way and cooling off too quick. How long do I leave it on for? 15 to 20 minutes, right? And when do I come back and check? 5 minutes, exactly. So in 5 minutes, I want to make sure I leave her a bell or a call light, or, I'm across the room, my proper name, so I answer. And then in 5 minutes, I'm going to come back. How are you doing? How does it feel? Any hot spots or anything I need to be concerned about? And then I take a peek. Make sure if I'm seeing anything, it's uniformly that mild pink. If you're seeing a deep red, you need to add towel layers, even if she's telling me, oh, it feels good. Some people will lay on it, it'll feel good until it burns. Okay, so you don't want to, if you're seeing a deep red, that's not what you want after 5 minutes. You need to put more towels. Okay?
Check your bony areas,
Yeah.
those will get hotter faster. So, it's red along her spinous processes, it might be too hot.
Especially in someone who's very thin too, because those areas, anything that stands up off the skin is basically going to be compressed more, and the more contact, the more heating. So you have to be very cautious of these areas that lift up off the regular contour of the skin, because they will get redder.
So where you get sunburn, those are the areas that are going to get the heat the fastest.
And then watch for metal in the area, belts, belt buckles, pants with metal thingies on them. Be really cautious of that, because that will heat up faster. Remember, it's a higher conducting material. Okay. What's our expected outcome? What do we expect to see at the end? It's going to look what? Red. A little red, a little pink. I prefer pink. Warm to touch. No isolated spots of a different color, darker red or white or anything like that. No raised skin areas. No pinpoint areas of pain. And it's going to be wet because this is a wet hot pack. Okay? So that's hot pack application. So what I want you to do now is practice the sensory testing, and then putting a hot pack together. For the cervical, it is a pocket. Okay, so if I were to be putting this pack on her, this is the side that will go to her skin. I have it like this. How many layers? There's 4, right? So this is a little bit on the light side as far as layering is concerned. But you want it to go this way. And why is that? Because that's the Velcro. Okay, if you're putting it on somebody and you're getting this kind of thing to it, that's backwards. Just saying.
Plus, don't put it upside down. I've had students come in the practical, they put it on upside down.
Yeah, this way.
Yeah, it falls.
This is not meant to heat up
out of
the-
the pocket. Falls down out of the pocket, and it goes up on your head, right? You really want it to extend down. But you're laughing, but I can't tell you how many students didn't know how to put it on in a practical.
Yeah, they did. It was a lot.
They put it on upside
They
down.
thought it was so easy, and then when they put it on, we had the pointy thing on that occipital protuberance, which is really not an area we're looking to heat up. Instead of being down on
Which
the
just showed us,
spine.
oh, obviously, we didn't put.
Yeah. It should be automatic by the time we get to the practical. That's why it should be practical. It should be the easiest thing for you guys. I know you get nervous, but think about it. If you do it enough, physically practice it enough, it will become automatic. And if you make sure you practice the steps, asking the questions, don't just flap it on each other. Position them, because this is the other thing. People put people in such interesting positions. I'll go through and show them, okay, this is a good position for the back. And then on the practical, because you've practiced on each other, standing, walking around, I'll see all kinds of things. It'll be like, that's interesting. Never would have gone there, but okay. And that's part of the practical, is the positioning. If you have someone that's uncomfortable for 15 minutes, I guarantee you, whatever treatment you did is not going to help them. Okay.
And also, if you're the patient for one of your colleagues, one of your classmates, and they put the pack on upside down, tell them, you put it on upside down, that's wrong. Okay, so
Yeah, give
help
each other feedback.
Yes, give each other feedback.
And not on the practical. Don't be like, giving the hint, okay? So sensory testing, light touch, cotton tips. We have cotton tip appliques, just make sure you kind of pull it off. I know it's hard because they're not really fluffy. And then break it, and that's sharp dull. You're doing the area where you're testing. You're comparing right and left sides. Remember the amount of pressure that you're putting, okay? And then apply a hot pack, okay? So, go to.